As we've said, with multiple providers treating at once and patients coming in every half hour and staying for an hour for their visit, there's lots of overlap and there can be multiple patients in the clinic at the same time. When you think of your role as an exercise specialist and maintaining safe performance of exercises and proper performance of exercises, this might seem overwhelming at times. Our expectation isn't that you're watching every person do every rep of every exercise. Let me give you a tip. The best practice for you when trying to ensure proper and safe performance of an exercise is every single time you start a patient on an exercise, watch the first and second repetitions. If that patient is doing that exercise right in the first 2 repetitions, the likelihood of them doing that correctly throughout is higher. Now, this doesn't mean that you can only watch the first 2 and then walk away and turn a blind eye to them, especially if it's a slower time and they might be one of the only few patients. However, this is a good guide to help you feel that you're doing your job well and not getting overwhelmed. If you notice a patient's not doing an exercise correctly within the first 2 visits, have the courage to stop them and say, hey, let me show you this really quick. In the future videos, we'll give you cues that will empower you to know how to step in and give correction, and also help you recognize what correction needs to be given in the first place. But what we want you to do is feel that as you try to control the quality over the first few repetitions, you will see that you set that patient on a course to be able to perform those exercises well throughout. If you notice that a patient starts out with good first and second repetitions and typically loses their form throughout the rest of the set, collaborate with the providers to figure out ways to ensure that that patient can do exercises correctly throughout the set. Feel free to stop and slow down and suggest to providers, hey, this patient isn't able to do all their exercises correctly. I think they maybe need a little bit more one-on-one attention to ensure that they're doing the exercises properly. When we do this, we can oftentimes look at the plan of care that we'd set out, and we might pare down the list of exercises that we left for that patient. We might start with 9 exercises and say, you know what, we'd rather have them do 5 exercises absolutely correct than to do 9 exercises with poor form. But again, while taking ownership over this, don't let it overwhelm you. Make sure that you are doing the best that you can, that you are setting them on a course for success by ensuring their first few repetitions are done correctly. As you do this, we will see better outcomes for our patients. If you feel that you don't have enough time, please ask one of the providers to coach that patient through their first 2 or 3 exercises. But also help us out because we don't know the flow of that patient's care that day. So you might reach out to one of your providers and say, hey, would you be able to take John and help him out on the bike? He's at level 4 for 6 minutes. That's something that will allow us to help you and help the flow be maintained for that patient that day without taking extra time from you or taking you away from what you're currently doing at that moment.